Please welcome the chair and the head of Medicare International Healthcare Exhibition Organizing Committee, Dr. Amal Harsha de Silva.
සුබ උදෑසනක් ඔබ සියලු දෙනාටම අපේ ගරු නලින්ද ජයතිස්ස ජනමාධ්‍ය සහ සෞඛ්‍ය අමාත්‍යතුමනි අප අමාත්‍යාංශයේ නායකත්වයේ දෙන වෛද්‍ය අනිල් ජයසිංහ මැතිතුමනි ලේකම්තුමනි අපට නිතරම සහයෝගය දක්වන අපේ සහෝදර රටවල් විශාල සංඛ්‍යාවක් මේ අවස්ථාවට සහභාගී වෙනවා ඇමරිකාව ඉන්දියාව සිංගප්පූරුව අතුළු රාජ්‍යයන් විශාල සංඛ්‍යාවක් සහභාගී වෙනවා. ඇමරිකාවේ තානාපති කාර්යාලයේ වෛද්‍ය අංශයේ ප්‍රධානී රෙබේකා මැතිනිය අපි ආදරෙන් පිළිගන්නවා. ඊළඟට අපේ ප්‍රධාන අනුග්‍රහය දක්වන මංජුල කරුණාරත්න මහත්මයා ආසිරි ගෲප් හොස්පිටල්ස් ලංකාවේ තියෙන විශාලතම හොස්පිටල් ජාලයේ CEO ජෙනරල් මැනේජර් ඉතාමත්ම සාදරයෙන් පිළිගන්නවා. ඒකම අපිට නිතරම අතීත දක්වන ජයන්ත ධර්මදාස මහත්මයා දන්නවා නවලෝක සමූහ ව්‍යාපාරයේ පෞද්ගලික අංශයේ වැදගත් නාමයක් ඒ ජයන්ත ධර්මදාස මහත්මයා සහ එතුමාගේ පුත්‍රයා ඉතාමත්ම සාදරයෙන් සහ ආදරයෙන් නමස්කාර පිළිගන්නවා. ඒකම අපිට හැමදාම අපිට ශ්‍රී ලංකාවට ඕනෑම අවස්ථාවකදී අපිට සහෝදරත්වයෙන් සැලකෙන ඉන්දියානු ධනරජයේ ඉන්දියානු රජයේ නියෝජ්‍ය තානාපති පාණ්ඩේ ડોક્ટર පාණ්ඩේ මැතිතුමා ඉතාමත්ම සාදරයෙන් මේ අවස්ථාව පිළිගන්නවා. මොකද අපි දන්නවා ඉන්දියාව කියන්නේ අපිට ඉතාමත්ම බැඳිච්ච රාජ්‍යයක්. අපිට ඕනෑම අවස්ථාවක අපිට උදව් කරන සෞඛ්‍යයට උදව් කරන රාජ්‍යයක්. අපි විශේෂයෙන්ම මේ අවස්ථාවේදී ඉතාමත්ම සාදරයෙන් පිළිගන්නවා. ඒකම අපිට මේ අවස්ථාව සහභාගී වෙනවා මොතිලා මැතිතුමා එතුමා ශ්‍රී ලංකා ටෙලිකොම් සංගමයේ කම්පැනිගේ සභාපති සහ ඊචැනලින් වල සභාපති. එතුමා අපි තාම සාදරයෙන් පිළිගන්නවා. මොකද එතුමාලටත් විශාල දෙයක් කරන්න පුළුවන් අපේ මහ ජනතාවගේ සෞඛ්‍ය වෙනස් කරන්න. ඒතුමා දැනටමත් ඒක ආරම්භ කරලා තියෙනවා. මේ ඉස්සරහට හිතන් ඉන්නවා. තව දුරටත් තවත් ඒවා ශක්තිමත් වෙයි කියලා ඉස්සරහට. ඊළඟට ඉන්නවා අපේ ළමා රෝහලේ අධ්‍යක්ෂකතුමා අපේ විජේසූරිය මැතිතුමා. එතුමා ඉතාමත්ම සාදරයෙන් මම මේ අවස්ථාව පිළිගන්නවා. ඊළඟට ඉන්නවා IIHS ආයතනයේ Dr. 𝐒𝐞𝐲𝐬 මැතිතුමා. මම හිතන්නේ man power training and foreign employment value addition to public of this country. He has done an excellent job as far as we are concerned, and therefore let me welcome Dr. 𝐒𝐞𝐲𝐬 also in this momentous occasion. Then there is Dr. 𝐒𝐻𝐿, who is heading Belstra Medical Care, who is doing a lot of innovative things in the country, and who is trying to do medical tourism in a big way in time to come. Let me welcome 𝐒𝐻𝐿 for this important occasion. Then also we have Professor Gunapal Nanayakara, the management guru in Sri Lanka, who has established the Postgraduate Institute of Management, and he is the chairman of a selection committee for awards in this country. And sir, welcome for Medicare exhibition in a big way. Then we also have Susantha Mallavarachi, president of the Poultry Association of Sri Lanka. You might imagine why we invite the Poultry Association for a healthcare exhibition. Actually, that is because they supply the proteins for our generation to come, and then to make our nation healthier. They bring soy from the US, feed the chicken, and it's a wonderful operation in the country, and it's par with the best of the world. And I would like to welcome Susantha Mallavarachi and also Atula Mahagamage at this particular moment. Then we also have Dr. Helaruwan Kumara, who has been doing assisted reproductions. Let me welcome you for this important occasion. Then Mr. Ismail is the chairman of Lloyd's Healthcare, very innovative company, and who is doing a lot of innovative things in the healthcare industry. And I think it's really nice to have you here at this particular moment. And then also we have our Geethamani C. Karunaratne. She is the chairperson of the Sri Lanka Ayurveda Drug Corporation and our former additional secretary Ministry of Health. So let me welcome you, Geethamani, for this important occasion. Then we have Dr. 𝐒𝐻𝐞𝐽, our dear friend, who is the Deputy Director of the National Hospital. Dr. Kumar 𝐿 is here. And then also Dr. Amal 𝐿, then Dr. Trishanta is here from the SPC chairman, and Dr. Priyanta Tapattu, Dr. Aruna. I think they are all stalwarts who are managing the healthcare on a day-to-day basis. Without you all, health is no more. Therefore, I think we have got all the giants in healthcare in this audience and in the dais as well. Now, there are very, very important people in this audience which we cannot disregard. There is Professor Harsha here, who has been training large amounts of trainees in the country. Then there is Dr. Sunil Handalage, who has come all the way from UK, and he is a great orthopedic surgeon. Was my orthopedic surgeon when I was at the Children's Teaching Hospital, Karapitiya, Gaul, and he was the only orthopedic surgeon available from that end of the world to Australia. Because there is no other hospital in that area, because everybody came to him, and therefore I think let me welcome him also. Then there is also Professor Nihal de Silva. He is the Chancellor of IHS, a very important personality, and let me welcome him also. And then our award winners are here. I think we will be talking about them in time to come. You don't win an award easily. You will have to work hard for it. And especially with Professor Gunupal Nanayakara, who is a management guru, it passes through him means definitely you have done extraordinary for you to win an award. Now there are many doctors in the country, about 15,000 or more than that now, of specialists, a lot of specialists, and they are serving all over the world today. And also in this audience, there is chairman of the Private Hospitals and Nursing Homes Association is here. Let me welcome you also, and then also past chairmen, Mr. Gurupuarachi and the whole crowd who are here, and also Mr. 𝐿𝐼𝐞𝐝, who is an icon in the medical industry now, and everybody who have been invited. Sorry that I am unable to mention all by name, but basically let me welcome all of you who are doing an enormous service for the public of this country. Now in medical care, we are so busy in our day-to-day lives. We are extremely busy that we have no time to advertise ourselves. We don't have time to talk about what the good that we create. We always get something bad happening. That is highlighted in the media, highlighted everywhere. Therefore, we thought the best thing is to showcase what we do on a day-to-day basis in healthcare. Now, I think the government hospitals do an enormous amount of service in the country. There are very few countries in the world you can go to a place and we ask the question, can you afford to have medical care? Sri Lanka is like that. You can go to any hospital, it's free of cost at the point of delivery. And I think there are 1,060 hospitals the minister is managing, and honorable minister is treating large amounts of patients on a daily basis in the country. Each person in the country is seeking about 4 times a year access to medical care. When you are extremes of ages, you see about 14 times a year, less than 5 years of age and above 65, 70 years of age. You access medical care. Therefore, medical care is part and parcel of a life. The honorable minister is doing a wonderful job, and I must say that he is a very, very minister who understands health well, and then who has a lot of touch with the ground of this country, ground people of the country, and also he is a good politician. He understands politics well. Therefore, it's a good thing to have a minister of that nature running healthcare in Sri Lanka today. We have been very lucky with health ministers. I must tell you, except for 1 or 2, we have been extremely lucky. This country has been very lucky with our health ministers. They are all selfless people. They have added a lot of merits when it comes to their own lives and how they manage healthcare. In healthcare, if you do well, heaven is very close by. And also if you slip, I think hell is also very close by. If you don't do well in healthcare, you are rewarded in a very bad manner. Therefore, I think in healthcare, you can do well, you can do good, and you can always make others happy, But in the meantime, if you are in the wrong track, you also can add a lot of karma for your life. Therefore, I think these are very important occasion as far as the country is concerned. There are many people who are here who have done many things for healthcare. I think MediHealth Hospital chairman is here. Then I think oxygen services were managed by Imran and the crowd. I can always remember that you go to each and every hospital and give oxygen. See what a lot of merit that you add if you do it with passion. Therefore, medical care is not that easy to deliver. It's not like buying and selling business. You buy something, keep a margin and sell it off, you have large amounts of profits. But in medical care, you got to have manpower, money, machinery, methodologies, other support, and then try to develop a service to be appreciated by the people who are physically down and mentally down. They don't come to see our faces in medical care. They come with a problem. Therefore, you all are addressing problems, and therefore we have a right to appreciate your services in a big way in the country. And I think we have a lot of stalwarts here. There is Shama Ananda coming all the way from Canada, and the husband, Chandi Shama, very famous. I mean, the thing is this: in this country, there are many people who are keeping up to their health. There are some people at the 86 years of age, they are doing marathons at the age of 86. Therefore, I think we must encourage the people also to be healthier and to be responsible for their own health. And I also want to mention Mr. Nihal de Silva from Marcel Group of Hospitals, who is running the RC Central Hospital, and all of you have been doing a wonderful job as far as we are concerned. Therefore, this exhibition puts together all the top providers of healthcare, private, public, Ayurveda, India and Singapore. And I must tell something especially about India. India has been extreme good friend of ours, Honorable Minister. Whenever we have a problem, we contact them. They have been never asking you as to why you are asking this. They have been always coming out with help. They have been giving us the COVID vaccine free of charge, even without asking sometimes. And then they have been doing a wonderful job of work as far as we are concerned. Thank you very much for being our strength in the health sector. Whenever we want to get trained, the Indian doctors come and train some of our doctors for high cost individual interventions. Our average health is much better. We are a small country. But in the meantime, our high cost individual interventions, we must learn a lot from India. And then our Ministry of Health, sir, you have a very good team of people to manage health. You must be very proud because all these people who are here have been doing a wonderful job. Whether it's Cancer Hospital Aruna, whether it's Atapattu from the medical services, I mean, you give a task to them. I'm sure that they are a good team of people for you to carry on your work well. And I think this is a golden time in the Ministry of Health. You have allocated a lot of money this time. The Honorable President Nandakumar Dissanayake has allocated double the amount of money than what we had last year. No, sir? That's what. And therefore, there is a huge amount of potential given to the healthcare professionals to do good, to maximize utility in healthcare. And therefore, I think, this is a very good golden time, and we are the opportune moment to have this healthcare exhibition. And I hope that you will enjoy the exhibition and learn out of the new technologies available in the country. This exhibition gives any ordinary person to ask any question from the top specialists in the particular fields. They are very rare occasion because you meet the specialist after channeling and all that, waiting in the queue and meeting them after paying money. But here is a situation where top medical specialists are available to answer your mundane questions. You can ask questions about your neighbor, neighbor's problem also you can ask. Like that, we are given an open up the medical profession to that extent, and they are coming everybody free of charge. No money is charged by them, and therefore this is a very good occasion that you can learn about new trends in healthcare, do networking as far as the government and the private sector is concerned. Sometimes we are so busy in our lives on a day-to-day basis, we don't know what's happening next door. We don't know what's happening in the private sector. We don't know what's happening in the next hospital because we are all very busy people. Therefore, let me welcoming all of you and hope that you will enjoy the exhibition for the next today, tomorrow and day after. Thank you very much.